Hello everyone and welcome back. This week we turn our attention back to the textbook and focus on Chapter 6, which specifically addresses the victims of sex offenders. As this is not a victimology class, we spend the majority of our time focusing on the offenders, but I do want to take some time and speak about the victims of sex crimes as well. Let's go ahead and get started. To begin with, we know that all types of people can become the victims of sex crimes. While it is possible that men, women, and children can all be victimized, it is more probable that women and children will be victimized more often than men. Since we spend 2 weeks focusing on child sexual assault, I'm not going to go into further detail about that now. Instead, we will speak more about adult women and men in this chapter. We'll start with adult women. As I said before, it's more likely that women will be victimized compared to men. As we know that women are more likely to report their victimizations than men, overall, we note that roughly 18% of adult women have experienced sexual assault at some point. When you break it down by age, we notice that younger women are more likely to experience assault than older women, and the most frequent assaults take place during the late teenage years, specifically between 15 and 19 years of age. But really, during the collective time period of about 10 to 24 years old, that's when women are at the most risk for experiencing sexual assault. It is important to note that there is almost an even split as to whether women will report a single victimization or multiple victimizations. These individuals who report multiple victimizations are often assaulted by a family member or spouse, compared to someone who reports a single victimization. In that instance, it might be a stranger rape or a case of date rape rather than a more familiar offender with more opportunity to commit multiple assaults. When it comes to men, adult men rather, there is still a strong stigma or taboo surrounding the idea that men can be the victims of sexual assault, when we typically associate them with being the offenders engaging in sexual assault. Granted, the reported prevalence of male sexual assault is much lower than for females, 3% compared to nearly 18%. But remember, that's just what we know about, and it is more likely that this rate is higher, but male victims are much less likely to report their assault than female victims. What is similar to female sexual assault is the age of first victimization. Like women, men report that their victimizations occurred when they were younger than 12 years of age. So we're seeing a similar age bracket to women. But what differs is the type of sexual assault that occurs. Males are less likely to be penetrated compared to women. However, remember that the definition of penetration has also varied over the years. Penetration is no longer considered just vaginal penetration anymore, so this rate might vary based on the definition of penetration that is being used. When we talk about criminological theories in terms of explaining victimization, there are a few that stand out compared to others. First, some theorists put more stock in a feminist perspective, and this is a pretty popular theory right now given the current political climate surrounding women's issues. If you think of things like the hashtag #MeToo movement that we mentioned before, or the Time's Up movement, or any of the women's marches that have been taking place in 2017 and 2018, you would be able to use a feminist approach to explain sexual assault through this perspective. And basically what feminist theory suggests is that the patriarchal culture is to blame for many sexual assaults because it has allowed men a position of power and authority over women for many years, leading to a line of thinking that sexual assault is allowed and permitted and will often go unprosecuted. Case in fact, the marital exemption laws that we've had in this country for many years, which allowed for a husband to rape his wife without any sort of legal consequence, or even just the example of the antiquated definition of forcible rape that we have discussed before. Both of these would fit in perfectly with a feminist explanation for sexual assault in this country. But the theories that I want to really spend time on and focusing on today are routine activities and lifestyle theory. We begin with routine activities theory. This is a general theory that should be able to explain all types of criminal activity, provided that the three elements are present, and it can. There is a role for the victim here as well. Cohen and Felson's theory suggests that there needs to be a motivated offender, a suitable target, and the absence of a capable guardian in order for a crime to occur. For example, let's say we're talking about a property crime. If I leave my garage door open all night, I have eliminated the capable guardian. My whole garage is open and exposed. Let's say that I have an expensive lawnmower sitting in my garage. That would be our suitable target. And all we need is for someone to want to steal the lawnmower. That's the motivative offender. If the first two conditions existed and you don't have anyone coming along who wanted to steal it, then the crime would not happen. Or if my garage door was down and we still had a motivated offender, then the crime would probably not occur because I took precautions to protect my belongings. The same applies to sex crimes. To put this in a routine activities theory perspective, we are doing something that increases the chances that a victimization might occur. For example, a child may get lost at a Walmart and is abducted because the parent is not there to prevent the abduction. The child may have wandered off without the parent realizing it, and there just happens to be someone there who wanted to steal the child. Or perhaps a sexual assault occurs because we're doing something outside the safety of our home. Because we're leaving our homes, we are presenting ourselves as suitable targets. And if we go out alone, then we do not have a capable guardian keeping an eye on us. For example, let's think of a date rape scenario. This is a situation in which two people who know each other may go out on a date by themselves. The rapist is the motivative offender who slips something in the drink of the victim, who is the suitable target. Because they are alone and no one is around to see the offender spike the drink, there is no capable guardian, so the offense can occur. While this is not a theory set to blame the victim does have a part in the offense, as I mentioned before. The lifestyle theory is similar in that it is discussed in situations in which the victim voluntarily places themselves in a situation that might not be safe, such as walking alone at night or being in a high crime area alone. This location then places the victim in situations that increases the likelihood or possibility that an assault may occur. These are pretty stable theories and have been used in criminological research for a while. More commonly, they are used to explain crimes that are not just sexually based offenses, but are able to provide support here as well. From the Belknap study referenced on your screen, the first finding suggests that rape was more likely to occur in the summer compared to winter. I have a picture of an ice cream on your screen, and you may be wondering why. Well, there is an old example out there regarding the correlation between rape and ice cream that can be explained by routine activities theory. If you've never heard of this relationship before, let me explain it to you. For a while, people have used the correlation between ice cream sales and rape because both seem to happen more often in the summertime. But ice cream sales don't cause rape. Instead, what we're seeing, or what this theory really suggests, is the movement of the victims. In the wintertime, it's cold out. We don't want to go out. We don't want to do anything. We want to stay indoors where it's warm. In the summertime, the weather is nice. We go out more. We do more things outside the house. And we also make ourselves more vulnerable for all types of victimization. Next, Belknap suggests that when women leave their homes, they increase the risk of sexual victimization compared to men. We know this to be true because this is when women are the least protected by any type of suitable guardian, or capable guardian, rather, whether it is a friend, a significant other, or a family member. But let me take a second to clarify that this theory does not suggest that women need protection or are unable to protect themselves. But what this does suggest is that anytime anyone is out in public and alone, they are at more risk for any type of victimization than they would be as if they were with somebody else or if they were in the safety of their own homes. This study also suggests that single women are more likely to be victimized than those women who are married or widowed. And this makes sense too. Single women are more likely to go out on dates with new people. They go out with friends and they do more things outside the homes by themselves. Married women in comparison might be doing all of these things with their spouse and therefore would not make a suitable target because there is an additional person present to prevent that victimization. The biggest thing that we have to worry about when it comes to victimization is the aftermath of the assault. Experiencing a sexual assault is a very traumatizing thing, and everyone will process this event differently. Some individuals may shut down. Others might turn to coping mechanisms such as drug or alcohol use, and others may pretend like it never happened at all. But it is important to let these individuals process the trauma however they need to without causing more harm to themselves or to others. From the sexual assault, the victim may experience a variety of physical effects, including physical injury such as cuts, broken bones or bruises, or on the extreme side, sometimes they may experience internal injuries or genital trauma. This is especially likely in women and in young children. Victims often contract the STD as the offender rarely uses protection during the assault. This also increases the likelihood of pregnancy for post-pubescent female victims. However, from a prosecutorial standpoint, this leaves evidence to try and find the offender. In the next chapter, focused on law enforcement, we'll discuss evidence collection through the use of a rape kit. We also see that from an overall perspective, sexual assault victims may have poorer health in general than those who have not been sexually abused before. There are also many health issues that the victim must process on the road to recovery. Physical injuries often heal much quicker than mental injuries. Like many people who experience some sort of trauma, sexual assault victims can develop PTSD or post-traumatic stress disorder. To be diagnosed with PTSD, someone who has experienced a traumatic event must also suffer from intrusion symptoms, where the event is re-experienced through flashbacks or in other ways, avoidance symptoms, where the affected individual attempts to distance themselves from things that remind them of the traumatic event, negative changes in the thought process or moods that started or became worse after the traumatic event, changes in arousal or reactivity, such as hypervigilance, and finally, the symptoms must last for at least 1 month and cause impairment in functioning. PTSD is more likely to develop when there is no social support for the victim, and instead the victim is blamed for the sexual assault. If the victim is blamed or treated differently by friends or family, then they might develop PTSD. But nothing affects the victim more than self-blame, or the thought that I could have done something differently to prevent this. I should have known not to trust this person, or I should have watched my drink better, or I should have walked home with friends rather than being alone. The idea that I feel to blame for my own victimization can be overwhelming and all-consuming for the person processing the trauma. It can lead to depression or self-harm in some cases. Similar to PTSD, the idea of rape trauma syndrome, or RTS, was introduced in the mid-1970s to explain the mental health effects of rape on a victim. Normally, the victim will process the trauma in 2 phases or stages. In the first phase, the acute or disruptive phase, the victim experiences this in the initial after effects of the assault. The victim may treat any sort of possible physical injuries, report to the police, go through a rape kit, and begin the mental acceptance process that the rape occurred, and now we have to move forward. This is a very difficult step for many. Many victims will be terrified, angry, depressed, or may need time to acknowledge what happened to them was actually rape. This can last a few days or a few weeks or even longer. It is different for everyone. In the second phase, the reorganization phase, the victim must figure out what to do next. What do I need to do to regain control and to be able to trust others again? This might involve counseling and treatment for a period of time to realize that what happened was not my fault and that I am not to blame. But one of the biggest hurdles that many victims will have to overcome is the idea of engaging in sexual intimacy with another person again. For many, it may feel impossible to want to have sex again. It is a difficult prospect to put oneself in a position where they would be able to trust a sexual partner again, and to engage in sexual activity with another while remaining vulnerable from an assault perspective. Sex is a large part of many relationships, and for many victims, this is the last hurdle to overcome in order to regain that sense of control that they have been missing since the assault happened. One of the first things that a sexual assault victim might want to do is to see a counselor. It is difficult for friends and family to provide help because they are often too close to the individual. A counselor provides an independent third-party source that the victim can voice all sorts of thoughts to without fear of reprisal in any way. Even though my friends, my family, or my spouse are providing me support, they don't understand how angry I am, how scared I am, how hurt I am, how distrustful I am. A counselor is someone who can be a sounding board for the victim, but there are differences in terms of who the victim might see. Rape crisis counselors, are those individuals who will see the victim immediately after the assault occurs, and mental health counselors will handle the victim's long-term treatment. Rape crisis centers started in the 1970s as a grassroots organization that responded to what individuals viewed as unfair treatment by medical personnel, law enforcement, and the legal system. They currently work in conjunction with other organizations such as hospitals and the police to provide hotlines for survivors of sexual assault to call crisis counseling. They also offer some sort of accompaniment to victims to the hospital or police stations directly following a rape. They sometimes offer short-term counseling for rape victims as well. The rape crisis counselor's job is to determine what the primary concerns of the victim are and how to best address them. These primary concerns can include the safety of their location immediately following an assault, the reactions of their significant others, upcoming forensic medical examinations, or what they should tell their children. They must be able to understand that victims often respond with anger and are different from those who respond with self-blame. They must also understand that the emotional response of the victim may be misdirected, or that they may be treated in a hostile manner. This is not a long-term relationship by any means. Once the victim feels safe enough to go home, a significant other is located, or the individual is directed into the care of a loved one, the relationship often ends and the treatment is taken over by a mental health provider. Professional mental health counseling is meant to be a long-term style of treatment in which the victim has continuous access to a therapist or counselor, and the two can work together over a period of time to help the victim deal with the trauma of the sexual assault. Once the shock of the sexual assault fades a little, the victim is better able to think and process their thoughts and emotions. The counselor is able to provide insight on how to cope with these emotions, how to process the anger, and steps to take to start rebuilding the trust that may have been broken by the assault. Cognitive behavioral therapy is one of the most successful styles of treatment for many sexual assault victims because it focuses on the thought process surrounding recovery. First, cognitive behavioral therapy suggests that thinking can affect behavior. So, if all I am focusing on is the anger or the fear, that I am more likely to lash out at loved ones or to isolate myself out of that fear. Instead, cognitive behavioral therapy tells us to focus on safe thoughts. For instance, that the offender has been arrested or is incarcerated and can no longer hurt me. My family is trying to help me and doesn't want to harm me. It's easier said than done, but through work, the victim can work on altering those thoughts from negative or harmful ones to more positive ones in nature. That's the second tenet of the therapy process. Finally, once our thoughts are changed, then our behavior can change as well. For example, if my assault has caused me to be afraid of men in general, I need to work on associating with men that I know won't hurt me. My father, my brother, my son, or my husband might be all trusted individuals who I know are not going to harm me. But my fear is overwhelming, so I might need to spend 5 or 10 minutes at a time working on being alone with these individuals. The rest of the time, I might need other women in the room with me so that I don't get overwhelmed by the fear. Slowly, I could work my way up to being alone with these men for longer periods of time as I work to change my thoughts and my fears associated with men in general. Some victims may be able to work through these issues in a short amount of time, like in a few weeks or a few months. Others may be in treatment for years, and others may never be able to get over the anger or fear associated with their assault. It's all based on individual level experiences, but we know that therapy has gone a long way to help many victims of sexual assault process their thoughts and feelings in the long term. Today we focused on the victims of sexual assault. We know that experiencing a sexual assault of any kind or of any magnitude is a very harmful thing and can have long-lasting impacts for the victim, their family, and their friends for many years to come. After the initial shock wears off, it's time to put in the time and work towards recovery, but there may be many stumbles during that time. The victim will experience fear and anger and will think about the assault for some time after it occurs. But eventually, many will be able to have productive relationships again after some time to heal. In the next chapter, we're going to focus on the role that law enforcement has in working with the victims to process evidence, to investigate the assault, and to work to arrest the offender. I will see you back here next time when we make our way to Chapter 7. Have a great day, everyone. Bye.